John, thank you. And George, thank you as well. It's really an honor and a privilege to be a member of the board of NCHC. And it's terrific to be here today. Very timely, actually. Good planning as far as when to have this kind of an announcement. The healthcare in America today is contributing the overruns 2/3 of the national debt issue that worries us. And it's going to just get greater. So when you look at the fiscal cliff and the debt ceiling issues, fixing the inefficiencies in healthcare has become, in my view, a patriotic calling. And I often reach out to my fellow physicians with that message. It's up to us, the physicians, the clinicians, the hospital leaders, and others, to take this seriously and really create a different kind of model for the future and for the patients that we're taking care of. The NCHC proposal that you have before you today is the only one of its kind that I have seen this year emerge in terms of a creative way to look at an additional $500 billion of savings. We've already proposed some significant savings in the Affordable Care Act, but it's not enough. And the beauty of this, along with the 80+ organizations, national organizations, that make up the coalition, is that it's a bipartisan concept. And that makes it important. So $500 billion of additional savings is really a step forward, and it's a bold contribution to helping to deal with the problems that healthcare is creating these days, even though there's some great things happening in healthcare. So there's 4 mega trends that have captured my attention, at least. And the first is that costs are just plain out of control. And we all know about that. But I think we tend to think less about 3 other critically important areas of focus. First is that science is progressing at an unprecedented rate. Even though there's some Luddites out there that would defund the NIH and defund a lot of research in the future, research has become global, and information technology has changed everything about how fast we can move forward. So science is moving forward just as the population is aging and more people are presenting who need care, and there'll be more and more fantastic innovation available to those patients. This is going to add to the costs. But it is an incredible time to be a physician or a clinician because of that, because of science. The second is that we live in an era of big data and information technology and analytics, and it really is the U.S. is the domain for both most of that science progression and the big data progression. And that analytics is going to give us better and better ability to see what's going on and give feedback to doctors and hospitals, nurses, and other clinicians on how they're doing, and have it be much more objective and risk adjusted in terms of the patients they're caring for than ever in the past. Now, that's a really positive thing, but I often say to my fellow physicians, the other side of it is there will be nowhere to hide for people who aren't producing the best care for doctors and hospitals. And that's a whole new era for us, but it's an opportunity because it will help everybody kind of decide to move forward and lift all boats, if you will. The third big trend is that consumerism is not a fad. It's for real. IBM projects that their healthcare costs for individual employees will migrate from $4,000 around 2000 to $28,000 in 2020. And of that, even though IBM's costs will double between now and 2020, the consumer, the patient, is going to be paying $13,000 a year of that. So, people are going to be paying a lot for healthcare. They're going to have to pay attention to the services that are provided. In the past, we'd try to get people involved, and it was nowhere is that going to happen. In the future, it's coming. And patients are not going to just be involved in the prices. They're going to be engaged in how the care is delivered. And we're looking at quality and patient satisfaction. Consumerism is not a fad. And so you put all those things together. You put the science, the big data, the consumerism trend, and the cost together, and we have to go with payment reform and delivery system reform. We have to make change. And it's going to have to be team care. And, actually everybody's got to practice at the top of their license. Specialist physicians, we can't afford the intellectual capital to train those folks, those individuals, my colleagues, to take care of primary care. We can't have primary care doctors taking care of patients that could be well cared for by nurses and others. And we can't have nurses taking care of people who could be cared for by other mid-level persons. We've got to use the workforce in the most efficient ways, and we're not doing that now. We've got to decide that, as John said, med-mal, the defensive medicine, let's find ways to reduce some of that. Take the SGR, the first thing in this proposal. Get rid of that stupid formula. And I want to mention something about that, because we need, as a nation, to move away from price controls and just arbitrary caps on spending. They don't work. The SGR is a price control. It is a cap on spending. And how well has it worked? We just kicked the can down the road now for 10 years. So, folks, the good news is that the best performers, as John mentioned, in this country are already producing health care that is 20 or 30% more effective and efficient than the general delivery system. So we know how to do it. If we could find a way to copy and diffuse what is the best of American healthcare in these regards, we'd be well on our way to the new future. So hopefully we can move past the divisiveness of this, previous election season and really affect some change in healthcare. Healthcare is a bipartisan topic. It's all Americans are included here. It shouldn't be partisan. The Affordable Care Act is a very positive beginning in terms of dealing with access and dealing with insurance reforms and a number of things, prevention that we needed to deal with. But it's just not enough. We're going to need better outcomes at lower costs consistently to deal with the problems we face and get the costs under control. So NCHC has put some bold ideas on the table. They're bipartisan, and they begin with the public sector. But the public sector, 50% of the total spending, right, can lead the private sector. So this is an important way to go. The fiscal cliff and the debt ceiling issues, they're upon us. Traditional approaches, price controls and caps on spending aren't going to get us there. We need to change how we do things. So it's time to guarantee equity. It's time to guarantee increased quality and lower costs and still protect innovation. And I think we have something before us that will help us do that. Let's get on with it. Thank you very much.